Good afternoon, everyone. James Hicks here from Hicks New Media Infotainment News. I am thrilled today to be joined by Jennifer Valcazar. Jennifer is the sales account manager at the Vascular Institute of Northern California. Today is really the first of a two-part series where we'll be going to talk about and provide some education on p.a.d, peripheral artery disease. Listen, your health is critical and cannot be taken for granted. We'll discuss warning signs, we'll talk about treatment options, and most importantly, answer any questions you may have about this disease. But before we get started with the discussion, I wanted to share a short, informative video about this.
I'm only 51, but my legs are killing me.
If you experience discomfort in your legs when walking or climbing stairs, don't ignore it. You may very well have peripheral artery disease, or p.a.d, a buildup of plaque in the arteries that reduces blood flow to the legs and feet. p.a.d is a cardiovascular disease that can lead to stroke, heart attack, amputation, even death.
But if I had it, I'd know it, right?
Perhaps, but while p.a.d has a number of symptoms, they can sometimes be mild and suggest some other cause. These symptoms are often missed. There might be painful cramping, numbness or weakness, or a weak pulse in your legs or feet, sores that won't heal, or other symptoms. Unfortunately, p.a.d is a very common condition. So, if you're over 50, or if you have diabetes, or if you smoke, you are at risk for peripheral artery disease. See your doctor, because that's a risk you don't want to live with.
Fantastic, fantastic. I apologize. I hear we may have lost a little audio during the middle of that. I've got too many screens going. Let me tell you something. Jennifer, I told you before we started, I got 2 screens over here and I got 4 screens over here. I am just not, every day is like Groundhog's Day again, like I said during the pre-show. So I forget some things. But Jennifer, how are you doing today?
I am fantastic, James. I appreciate you inviting me onto your show. How are you today?
I'm hanging in there. I'm blessed, and I am glad that I believe we have a number of folks joining live who can definitely benefit from the conversation. I think we all can benefit from the conversation, but again, I think that this will resonate definitely with a lot of the audience today, and the folks that are either listening live or going to be listening to a replay and can take some action on it. So I tell you what, before we get started, tell the folks a little bit more about, give us the elevator pitch on you. Tell us who you are.
Let's see. I am a road warrior. So I am out every day visiting the local cities of Sacramento, Carmichael, Placer County, all over, all the counties. And my goal is primarily to help folks reduce the risk of amputation. And I'm very, very passionate about it, and I'll tell you why. I've had 2 family members pass away with amputation. And had they known that they had the proper care available to them, then they probably would still be here today. So my mission here today is to have a little fun, but also show the education that we have available at Vascular Institute to reduce those worries and reduce those risks so that you and family members and friends and associates can all live happily and healthy and thrive.
I appreciate that. And that your story proves that what you're doing resonates with you and it means something to you, right? You're not just out there doing a job. This actually has personal meaning for you. So I hope that really resonates with the folks that are listening as well. And I hope they are comfortable with typing in a question so we can address those because this is critical. And again, kind of as we were talking about during the pre-show, there could be apprehension to going and looking out for yourself. Why right now? Maybe because, the pandemic and because you don't want to go into a hospital. And, let's be frank and let's get focused here. There are folks that are still timid and apprehensive of getting like the vaccine. So there's a lot of pause when it comes to getting medical care. Primarily, again, I'll talk about the African American community, and I want to make sure that we kind of address that and talk to some of those fears, some of those concerns, talk folks away from some of those fears and some of those concerns, and actually move forward with getting taken care of. So
absolutely, yes, and again, I really appreciate your time today because the value is very purposeful, and I'm very passionate about sharing this education because I do honestly want everyone to get a little piece of what is simply it's a simple procedure. It's very simple, and we will reduce the fear and the apprehension and even anxiety.
fantastic. We've got a handful of questions here to go through, and again, they touch on the subject, but I'm sure folks will chime in as well. So I think let's start here, right, at kind of at a
Uh-huh.
high level, because again, a lot of times we will hear something and we think it means something else, and then that causes hesitation, right?
Sure.
Because we think we've got CAD, we've got coronary artery disease as opposed to peripheral artery disease. So walk us through exactly what PAD is, and is it similar to CAD?
So, our body is composed of arteries and veins. Arteries, they shift blood, to the heart and away from the heart. And veins create, oxygen to move through your body to create the advantageous space so that we can thrive, in our body, and we walk and talk and do all these things with our heart, and keeps us moving and grooving. The difference is peripheral arterial disease is the lower extremity, and the coronary artery disease is the upper body. So let's kind of like just separate that for a second. Both diseases are a result of atherosclerosis. So when folks, you've gone to the doctor, maybe some of your family members have had coronary artery disease, and how it works is they have gotten tests where they put a dye into the artery to see if there's any kind of blockage. Well, the same thing applies to peripheral artery disease, except it's in the lower legs. And how that works is your arteries from your waist down can also get clogged with plaque and fatty lipids. And what happens is when those things continue to manifest, that's when they can get completely blocked. The same applies for coronary artery disease, except for the flow stops towards your heart. So your legs and feet need the blood flow in order to keep you moving and thriving. Same as the blood flow needs to go to your heart to keep moving and thriving. So they are similar in the results that they are both with the fatty lipids, and definitely with plaque. It's just in two different places.
So you're essentially telling us, don't be sedentary, get up and move, right, to make sure that we don't have those types of issues, because as with the proper diet, as with not eating the things that are bad for us, maybe getting more towards I'm gonna say it, getting more towards a plant-based diet. I know some folks don't want to hear that, but again, eating more nutritious foods, that helps the entire body and obviously helps the heart. But just being active, being mobile, those are the kind of things that can possibly help reduce the chances of getting PAD. Correct?
Correct. PAD and CAD. And the reason why is because when you are active, it allows those arteries to keep the blood flowing. The blood will continue to flow through your body. So the plaque doesn't have a chance to build up. And you're right. That in the fact that eating healthier, we all know. Our mom told us, our dads have told us, You're going to eat that? Are you sure? Our spouses tell us, Even, our siblings tell us, one may be more healthier than the other, and trying to tell them, if you ate this, you wouldn't be like this. And we're like, yeah, it's all good. But then we resort to what we're used to. So it's kind of like, we're in a comfort zone sometimes. And just by getting proper education, but it's not even proper education, it could just be reducing those things that are not good for you. You can still enjoy them because we all like cake, right?
Definitely.
We
Definitely.
do.
I may have some tonight. Tell you what. Yeah, just tell you what.
Right? But it's just minimizing it. And because in all essence, we love food. And there's just varieties of food. It could be Southern food, it could be Latino food, Mexican food, it could be Japanese and sushi, but everything's always in moderation. So with that said, if you're aligning that with walking, or even if you're in your chair and you're moving your legs while you're watching TV, it's consistently moving that blood flow to create the absolute, like, optimum body care. Because a lot of folks think that they have to be athletes. A lot of folks think that
Okay.
they're going to have to go climb some mountain in order to be, this health guru. But that's not true. If you're even just moving your arms up and down, and and just like that while you're watching TV, or while you're reading, you're moving your feet, or even if you're going up and down the street on your block a couple of times, it gradually improves because you'll feel better, you'll breathe better, and you'll say, wow, I could do 2 more steps, which leads to 2 more blocks, which could lead to 2 more miles. And then it just all works out. So moderation for food. And then as much as your body can take as far as walking, just moving a little bit, is very, very important.
Let me ask you. So that's interesting, and I guess I'm gonna put myself in your shoes.
Okay.
Is that probably the harder conversation that you have with folks, right? Telling them to change their mindset or change their activities, right? I'm gonna use the analogy. Is it hard to teach the old dog new tricks sometimes when again you've gone 20, 30 years, however, of being one way, one mindset. You've grown up a certain way, you've eaten a certain type of food, or whatever the case may be, and you've gotten sedentary again. I mean, is that the hardest thing to change when you have clients and patients come in to tell them you got to do this, or else these are the negative consequences of these inactions that you're having?
Well, that applies to life in general.
Mhm.
And the reason why I say that is there's always the good and then there's the bad. So we love the good, right?
True. Yeah.
And we're excited. It's like, okay, we're going to go and have a celebration, and we're going to enjoy this great food, right? And then you go to the doctor on Monday and they said, you're not feeling so good. You got a tummy ache. And they're like, well, what did you eat this weekend? Oh man, we had this, like, just a buffet of food, and we had drinks and things like that. And then it's like, well, Mr. or Mrs. Smith, here's what's happening.
Yeah.
Because you're eating these things, the reason why your stomach is hurting is because, well, we know a lot of times you've heard, on TV, you've heard on radio, you probably have read in an article that we have gut issues. And that is a result of your body absorbing all the bad stuff. And then it can't expel correctly. So it lines in there, and then it's just really hard on your tummy. Okay. But that's just one part of it. It also goes through the rest of your body. It leads to your heart, leads to your feet, even leads to your brain. And so when you ask about how do we make those changes, yes, sometimes it's hard to teach, old dog's new trick. I'm going to tell you the truth. However, the good thing about it is we put ourselves in their shoes. And we understand because maybe our uncle or maybe our grandma or, maybe a family friend, we know that if they've experienced something just like what they're going through, we know that how can we help them create a solution?
Mm.
So what we do is we invite them to share the things that they're doing, and then the mindset actually is based on them making the change. So we just give them the tools, and we say, if you did this, this is a good thing. This is good.
Yeah.
And if you don't do it, just like I said before, it's bad. And no one likes to align with bad. No one really does. There's this world, even though we experience bad things in life, at the end of the day, we always want things to be good.
That's true.
So our body is sacred. So why not take care of that? Because that's what allows us to talk and walk and, go out with our friends and have life experiences. If we didn't have this, we wouldn't be here. So that is actually the choice that someone would like to make. And we say, we'll give you these tools. It's up to you. Now, if they say, oh, well, I'm not going to listen to that. Okay, well, you're not going to listen to that. But then what happens is disease becomes very critical. And once it goes critical, sometimes there's no turning back. So it's not that we want to put fear in them. That's not it at all. But what we want to do is we want to provide them all the things necessary to build to this healthy state, so that being proactive allows them to live so much longer that they forgot about all the little things that they needed to do to get there. It just becomes like, wow, this is great. I'm feeling good. So.
I love that. So that leads me down a path of asking something like this, right? Again, we can be doing, let's say we're doing the right things. Let's say we're eating right. Let's say we're exercising. Let's say we don't have any family history or anything of that nature.
Mm-hmm.
Could PAD actually, could we be suffering from that and essentially not be aware, right? I mean, what would be a scenario where that would be the case?
So just like last year in 2020, we heard on the news about the COVID-19 and how it was asymptomatic. Same thing applies to PAD. So now, you said about, having it run in the family, or, if you're taking care of yourself, pretty much you'd be all right. Okay. But if it runs in the family, or if your lifestyle has been increased with smoking, or you're 50 plus, or you've had previous heart disease, or there's a couple things that can be going on with your body. Those can be symptoms, things that you'll see, but the asymptomatic ones, you won't see them. You won't know it. And what happens is, most folks will assume, oh yeah, it's because I'm getting old, right? I'm growing old. And when I was 15, I could run and jump and, and do all this stuff. And then as we get older, we connect it to older age. But that's not always the situation. So say, for example, for myself, I go for a walk. And I'm walking and I get this little pang in my calf. And I'll tell myself, well, you know what? That's because I haven't walked in about 3 months. So I'm getting this little cramp. And, I go home and I'll sit there and I'll keep feeling this little pang. But it's like, no big deal. Or folks are told that when you get cramps in your legs, you may connect it to being dehydrated. So you drink a bunch of water.
Right.
Sometimes it could be that we've been taught as kids, you don't have enough potassium, you got to eat more potassium. So then we'll eat spinach, or we'll have beets, things that contain the potassium to get rid of the cramps. But in essence, it really could be PAD, and we don't even know it. Some folks, they'll have cramping, like a little cramp on their hip, and they may think, well, I was an athlete in my teens, did a lot of running, football, soccer, whatever have you, basketball, jumping, and then you put that pressure back down on your hips. So you'll think that, oh, that's a result of, being doing so much activity when I was younger. And, maybe need a hip replacement. But on all essence, what could be happening is those arteries are working harder to move the flow of that blood, and it's creating those pangs that we talk about. So
Yeah.
even though, you may think that, oh, that's nothing, it can be asymptomatic. You wouldn't even know it.
That's interesting. And Mr. Kowaleski here, who's left this comment, obesity is at the heart of so many of these things. Type 2 diabetes, heart disease, and others are all That's a big word, John. Why do you have to, I can't even say that word, but I'll just say symptoms of obesity.
Comorbidities.
I can't say that. I'm an engineer, dude. And you're coming. He's a certified personal trainer as well, so he's got insight into a lot of the health aspects as well. But that goes in alignment with what you were just saying, right? Again, what we were talking about earlier, take care of yourself. You've got to do it. There's no reason to wake up and be in pain throughout the day, right? I mean, we're not supposed to have back pain, neck pain, whatever the case may be. That is not what life is supposed to be about. And if we fuel ourselves appropriately with the mental, the physical, the spiritual, all of that, right? Just take care of ourselves from a well-being side. Back pains, foot pain, chest pains, things that really shouldn't be something that's commonplace. And I think I keep harping on for the audience that's watching right now, if you're in that particular state, if you are having issues, if you feel something that doesn't feel right, you know your body better than anybody else,
Exactly.
right? Go have it taken a look at. Yeah, even right now, when everyone's got to wear masks and everybody's got to be 6-7 feet apart, that is no excuse for not going and having whatever ails you corrected or investigated. Check it out. Don't walk around hurt all day. It's just not a good look. So I'm glad and so this wasn't even planned. I'm glad Jennifer and I are kind of meeting in the middle, right? In terms of our messages, and we've got some comments that are also ringing true to this message.
Let me elaborate on that, because I do know that last year, they put a lot of fear of folks going to the hospital. And so what happened was, because a lot of, community members didn't go to the hospital, they had critical problems. We not only had folks pass away from COVID, there was a across the board of, heart disease or things factored because of diabetes. And it's because they were afraid to go to the doctor. Now, let me say, the greatest thing is, if you're not going to go into the office, that's fine, because we'll eventually get you into the office. Because what happens when you have a telehealth call, you can get on the phone with your doctor and say, you know what, I'm really not feeling good. Now, what they'll do is they'll ask you a series of questions. Based on that, it's either, okay, you know what, by what you're telling me, you should go to the emergency.
Mm-hmm.
And if they're going, oh my gosh, no, I don't want to go to emergency because of COVID. Well, what happens is they'll separate you. They separate those folks that are having, dire situation at that moment. They pull them aside and everything's sanitized. It's not like what people think. COVID is just different. They're folks that were ill with COVID, they're in a whole different section of the hospital. Okay. However, there is what's called your normal primary doctor. And what they are doing last year and this year is they're doing one-on-one. Mm-hmm. And so instead of having a bunch of patients waiting in a room, may give you, like, how like when you go to the restaurant and they have that little buzzer that tells you to come upstairs, and get your food. Right. Same thing applies. They'll call you, or they'll give you that buzzer to say, okay, we'll have you in now. And they'll open the door for you, go in, and it's more of a one-on-one. So folks, please do not be afraid to see your doctor, or even picking up the phone for a telehealth call. They're more than welcome to do that. And a lot of folks may not know, but telehealth, they don't bill for it, because it's actually, so for example, if you walk into the office, there's a copay. However, for telehealth, because it's on the phone, They don't charge you for that because they want you to be healthy. So in this moment, like now in 2021, what's good about Vascular Institute is we are a one-on-one. We're outpatient. We're not the hospital. So you could come into our office and have a one-on-one consultation and not even be worried about it because, not only are we sanitary and, we wear our masks and all that, but you don't have 10,000 people in there waiting.
Awesome.
So there's only one or two of you. So it's very fantastic. So
cool.
just a rule of thumb.
I like that. Yes, folks, we are hitting these messages home. We are, I've always heard that you got to hear the message at least 3 times before it sticks. So we are drilling it in. And it's interesting you mentioned about telehealth as well, because I got a press release today from one of the medical organizations, and they were saying telehealth is here to stay, irregardless of when everyone gets the jab in their arm, right? Telehealth is become incredibly successful. It's become incredibly efficient for the physicians and for the patients as well. And again, just the statement that you made about, again, you don't pay a copay to set an appointment with your doctor, with your physician over the phone. They can do video, they can do audio. Again, it's encrypted, so it's very private and very secure.
Yes.
Definitely don't shy away from booking a appointment with your health practitioner and getting whatever needs to be looked at. Let me ask you about get back to p.a.d. specifically, and in terms of how it affects people, men, women, maybe different ethnicities, different races, those types of things as well. Is there any data around, again, how maybe men, or just how p.a.d. affects different types of folks?
Well, so for example, when I was telling you before about asymptomatic, so women have less symptoms than men do, but it's more prevalent in men. And the reason being is they have larger muscles in their legs. So what that said is, there's no blood flow to the legs, and the tissue starts, to deteriorate, and they'll feel it quicker because, the tissues in the muscle are collapsing and they're cramping. And that's when you get the result of cramps. Now, for women don't have as many symptoms or none at all. And so, for example, if a woman did have symptoms equal to a man, would be sore on the leg or on the foot that just doesn't go away. So say, for example, maybe you've gone, you've gone to the beach, you wanted to get out of your home, you just need to breathe some air, and you go to the beach and you happen to step on a piece of glass by accident. Okay. And then you go home and you clean it up. But then after a couple of days, you see that it's really not healing. And then after maybe another couple of weeks, you see it's kind of still like it's kind of looks infected. But you're going, oh, I'm putting all, my cortisone on there, everything looks good, but it's really getting worse. And what happens there is the fact that the blood flow is blocked, cannot allow that blood to go down towards the foot or the toe to be able to heal it. So what happens is that in time, that wound will get worse. And if it numbs, which is like a neuropathy if somebody has diabetes, they're not going to feel it anyway. So they're just thinking, oh, it doesn't hurt. So what happens is it gradually gets worse to the point of becoming critical. Now, I use that word a lot because it can get critical really fast if the symptoms are there or if you see things that are there. Another example is changes in the appearance of your legs. So sometimes you'll get a discoloration, almost like a bluish in color. And that is a symptom of p.a.d. Another one would be that you get you see redness, a lot of redness, or maybe even swelling. That is also part of it. Changes as far as, say before, maybe your toenails would grow so fast and you're like, oh my gosh, I have to cut them every week. But now they're not growing as quickly. And you think, well, maybe as I'm getting older, they're just not growing the same. Well, the reason being is because the blood flow is not going down to the toes, which doesn't allow the toenails to grow. And lastly, one foot could be colder than the other, or a leg could be colder than the other. What that means is sometimes in the weather change, like me, for example, I'll go up to the snow and it's cold anyway. So sometimes my foot does get a little bit colder, or the other one, they get cold because of the weather. But if you're in your home and you have the heater at, your standard 70 degrees or so, and you feel a foot or a leg colder than the other, that's a symptom. Lastly, the other symptom would be that you have like the hair. So, men have hair on their legs most of the time, unless they're shaving, if they're, athletes and they're racing on a bike, or they just like to be clean shaven. However, if the hair is not growing back and you get a shiny look on your legs, that could be another symptom of PAD.
Wow.
And the difference between women and men is that for men, it also can cause erectile dysfunction. And why is that? Is because the blood is not flowing as it would in your upper arteries of your lower legs. So then it shuts it down. And some men will say, well, I'm a little older now, doesn't work the same. And they'll think that. But if a gentleman has high blood pressure and he's taking meds for it, and he's trying to control it, that in alignment with peripheral arterial disease is that the blood flow is constricted, because when you have high blood pressure, it constricts your vessels. So then you won't be able to, bluntly say you can't have an erection. A man can't have an erection because that blood flow is not going through. So that is what the difference is between the men and the women.
Hey, you know what? Talk about it. My old pastor used to say, and he used to say, "Make it plain," right? So, so you say what you got to say. I hope Pastor Isom is on, so I'm sure he remembers Reverend Davis making that statement. let me ask you about this question that came in from let's see, Jeff Stone. Good to see you, Jeff. Are you aware of familial hypercholesterol? Here's another big word. Really, you guys? Hypercholesterolemia. If so, how might it relate to PAD? Fantastic question. Great.
That's a really good question. Yes. Now, our doctors are very confident in what they do. And this question here is something that we want to save for when the doctor comes on, because this is more of, it's cholesterol driven. Okay. But there's a little bit more intensity in the explanation of that. But let me kind of do like a kind of short term on it. So cholesterol is functional. We need certain cholesterol. We need the good cholesterol, and then we have the bad cholesterol. Okay. Right. Now, when it's excessive or not enough, either way it's not good. Okay. So there's the difference in the different types of cholesterols that you have. Now, connecting that with what you eat can definitely grow cholesterol, and that's what creates the plaque. That's what aligns on the arteries, where it's starting to create cholesterol buildup on those arteries. And so technically, cholesterol has a lot to do with PAD. In the instance that this gentleman is talking about, I would prefer that the doctor do a deeper explanation on that, because the clinical aspect of it will definitely give you a better understanding of how that works.
Okay. And what Jennifer's talking about, yes, folks, this is part one of part two. As I was saying in the intro, we are actually going to have the doctors themselves come on a future date, and we can really dive down into some specific questions that you may have, and they'll probably show images that will make you just maybe cringe a little bit, but will actually, sometimes you got to put it in your face, right? And sometimes you got to see you got to see what's really going on there before it to resonate and for it to be made real for you. So yes, stay tuned for that, and make sure that you subscribe to the channel so you can be made aware when we do have that next session with the doctors themselves.
Yeah, they get very clinical, and sometimes what some of the clinical terms you'll say, oh gosh, what is that? But what's amazing about the doctor is they will put it in our terms so we can understand it, and then they can help relay information that we may have been told by another doctor, and then how it correlates with PAD. So it's very amazing. Yes.
That's good. That's good. And I think that brings to this question, right? Because we've talked about a lot of negative. We have, right? So far, we've talked about, you could have no symptoms, you could have it, you can have multitude of symptoms, and it could be somewhat devastating to your mentality or to your mental state because you think you've got, again, PAD. But when you actually go into the office and when you actually sit with a doctor, what are the actual steps that happen from a screening perspective, maybe from a treatment perspective? Because I think hearing this will take some of the assumption out, and some of the folks going on something like a WebMD and try to diagnose themselves, which is always wrong. You definitely, you don't want to Google everything out there, because you might find something that you're looking for. So let's hear directly from you in terms of what some of the types of screening are.
So here's the good thing. This is what's good. See, it's good. You say negative, but really what the end result is, it's good. And why I say that is because folks believe that, like you said, if they're looking at WebMD and they're looking up all these things and they're like, oh my gosh, I have it, or, I have these palpitations, that means, something really bad is going to happen to me. But what it is, just like you said earlier, James, is that we know our own body. We do know our own body. And the beauty of that is, if we're proactive and we screen, we rule everything out. We can rule it all out. And then we're like, oh my gosh, I was healthier than I thought. Then you go on vacation and you do more good things, right? Because you're so proud of yourself for that accomplishment. That's a huge accomplishment, I think. When we take care of our bodies, and we are proactive and say, you know what, I'm going to go see what that entails. You are like loving yourself. And we love people every day. We love our family members. We love our spouse. We even love our dog. Sometimes we love our dog and we put those little outfits on them. We love them so much, but we forget about loving ourselves.
Wow.
And so be generous to yourself. So when you go into our doctor's office, this is what happens. It says easy. Notice how I said easy, as taking off your shoes and socks. That's it. Very simple technique. What it's called is an ankle brachial index. So we all know what a blood pressure cuff looks like. We know it goes around the arm, and we know we pump it up and then we get our blood pressure, correct? Same thing happens to your foot. So what the doctor will do, they'll put the cuff around your ankle and they're testing for your blood pressure. So they align it with the blood pressure that's in your arm, and they'll test your ankle to see if it's high or if it's low. Now, if it's very low blood pressure, the next step is they use what's called a Doppler. And a Doppler is a form of an ultrasound. And it's probably about this big. And it has a little wand at the end. And what they do, just imagine that, just imagine this is your calf area. So the doctor, he'll put the Doppler and he'll just go up and down and he'll listen for blood flow. So if he's going down the leg and he hears like, whoop, like it stops, then he's like, okay, well, there may be a possibility of some blockage. So then the next step is they'll do an ultrasound. Ultrasound, all it is basically creating an image, a picture of the interior of your leg. So it looks at the tissues and the arteries and the veins. Simple. It really is that simple. So based on those images, the doctor then reports his findings. He'll say, wow, amazing. Everything's going good. You know what it is? It could be just a little bit, of your veins. Your veins could be just, having like a little bit of blockage. But it's nothing that is crucial. Okay? So maybe they'll say, change this habit or stop smoking, whatever have you. They'll give you that information. But if your arteries are clear, good to go. No problem. Have a nice day. Come and follow up with us in 6 months if it runs in your family. If you're pushing, 60 years old now, you were 55 when you came, in 6 months from now you're going to be 56. Well, let's do it again. And let's do it every year if we can to prevent it. Because when you're proactive and you check it and you've ruled it out, there's more chances you're not going to get it. So those three, ankle brachial index, the Doppler, and an ultrasound are the three tools that they'll use to help define if somebody has PAD.
That kind of sounds less intrusive than a dental appointment.
It's very
Right?
minimal. It's absolutely minimal. I mean, because they don't go inside. So everything's on the outer extremity. And then when, say for example, if somebody has diabetes, and the doctor will see a little bit of the plaque buildup.
Okay.
Sometimes all they need is medicine. Sometimes all they need is a compression sock. And they'll say, okay, and you do a little bit more walking and you're fine. And it goes away. So this is why, because when you wait too long, I have seen it personally. Doctors sometimes, primary doctors aren't educated. And let me tell you the difference of an interventional radiologist and a surgeon. So what do you think that means? What do you think the difference is between the
She's
two?
gonna put me on the hook here, right? Definitely the surgeon is the one that is not, I don't say the last result, but I'll say is the most intrusive.
Absolutely.
Okay. I was always a B- student. I was in the middle of the class. I was never in the back, but I was, I was a B-
That was
student.
an A+ answer, James. I'm just saying.
Love it.
So what's really good is that folks don't have to fear. You don't have to fear. You take that out of the equation.
Let me ask about the timing, right? Again, come in for screening. How long does it take, right? I mean, is the three steps that you just mentioned, just barring all things equal, right? The doctor doesn't see any issues. Is it 15 minutes? Is it 20 minutes? Is it how long does something like that take? Because will you, as the patient, sit there and wait for any results to come back, or are they something subsequent that you get after you leave?
Good question. That's a good question. So when you go in for the initial ABI, the ABI takes about 10 minutes. So if everything's good, they say, have a nice day. Thank you very much. Thank you for coming in because you cared about yourself. Okay. If they see that there's something going on, they'll go ahead and use the Doppler. Doppler takes about 15 minutes.
Okay.
So for those two things, you were looking at about a half hour. And then if the doctor says, you know what, with the Doppler, we see that there might be a little bit less blood flow than we thought, what they'll do is they'll set you up for a consultation. So you'll come back another day. You come in for the consultation, and then they will do the ultrasound, and they'll take the images. So then based on that, you go home and then the doctor will have the findings. Then he'll bring you back in and then he'll say, well, we can do a couple of things. So they give you a couple options as far as procedure is concerned. Now, I said procedure. I did not say surgery.
Yeah. Words
So here's-
matter. Words matter.
Words
Folks,
matter.
listen, folks. Yeah,
Woo!
I like that.
Let me tell you. So surgery, if you went online tonight, if you go on the internet tonight and you pull up surgery, like James said, they go, it's invasive. What does that mean? That means they have to use a scalpel.
Mhm.
They have to cut. So when a surgery is performed for peripheral arterial disease by a surgeon, not only is there pain, but there is long recovery,
Makes sense. Yeah.
high costs, and lots of rehab. So it's not something that nobody wants surgery anyway. I said that in the beginning. Nobody wants surgery. Sometimes we have to do it for other reasons, but there's a lot of interventional radiologists now that even work alongside with the cardiologists, and they can provide procedure. And what the difference is, a procedure is basically they're putting a little incision. I can't even show you how little it is, but it's small. And the doctor inserts a catheter into your leg, into the artery.
Mm-hmm.
And then there's a little scope that goes in there, which is the camera, so that he can see what he's doing. And what's so fantastic about it, it's literally probably only an hour long for a procedure, outpatient procedure.
Okay, so that's good to know to take into consideration too. Okay.
Yes, and it's not, hours on the table. And then the next thing, so when the doctor, he gives the options for the procedure, then you talk about it. Maybe you bring your family member in with you, talk about it, and they'll say, okay, this is what we'd like to do. Okay. So then we schedule you for your appointment. So you'll come in whatever time is scheduled for you, and you'll be in a room where, you get comfortable. So the other thing is when you folks go to a surgery, they have to be put under anesthesia and put to sleep. With a procedure, it's what's called conscious sedation. So you're actually awake. And you can talk to the doctor. And sometimes we have fun in there, in a professional way, because we want to make it, it's serious, but it's lighthearted as well, because we want the patient to feel very comfortable where they're at. It's still nerve-wracking, because just like you said with the dentist, no one likes to go to the dentist,
Yeah.
However, we facilitate that. We make sure you're comfortable when you arrive. We make sure you're comfortable when you undress and put your gown on. We make it comfortable when you're in the OR suite. And then because you're awake, we can tell you what's going on. And it's actually, a lot of patients appreciate that, because they feel like they're included and they're valued, because we're saying, oh my gosh, this wasn't, this is great. So what happens is when the doctor goes into the artery, and they can see it on what's, an intravascular screen. So it's ultrasound interiorly, and they'll look, the doctor looks at it, and then our tech will say, well, doctor, you have this much diameter to work with. So of course, how small an artery can be, or a vein can be. So with that diameter, then the doctor can determine what kind of tool he can use. So he has a very micro blade, very little blade, tiny. And he can use one that's rotating. He can use one that's chiseled, to take the plaque off the side of the artery. Or just depending on, even if it's light, then he just uses kind of like a little chisel, and he taps it off little by little. And then he vacuums it out. And then he turns on the little faucet, because of course you have to close up the artery, right, when you're doing the procedure.
Right.
So what's really wonderful about this, now get this, when you turn it's like the faucet on, like in the kitchen, you're turning it on really strong, right? And the blood flows through the toes. You can see the difference right then and there on the ultrasound. You can see the blood flowing. It's amazing. It's beautiful.
Wow.
So then the patient, he's like, are we done? And they're like, yeah, you're all done. So then you go back to the patient goes back to the recovery room. They lay down for about an hour. And in that time, reason why we have them wait is because we just want to make sure that the blood's consistently flowing. There isn't any kind of, clogging going on.
Mm-hmm.
And then those patients walk out of there.
Gotta love that. Gotta love that.
They don't have crutches. They don't have, where they have the stitches going all up their leg where they can't leave for a week because they're in recovery and they're ICU, whatever have you. They are walking out in an hour and they can go home to their families or their friends or whoever that they're hanging out with and celebrate.
And move on with a regular. So you mentioned a couple of things there that I want to make sure that we don't gloss over.
Okay.
Any type of procedure, any type of medical, I'll say surgery, but any type of time when you have to go into somewhere, you got to put a gown on and you got to be whatever, you got to lay on a table, whatever the case may be. There is anxiety around that. Right. For everyone that's involved. And I like the fact that you, again, try to meet folks where they are and keep them informed. I'm really happy that you went into some pretty decent detail just now, right? In terms of the tools that you use, the different types of scalpels, the different types of equipment that the doctor uses and talk to folks about that, because really you want to know about that ahead of time, because that helps to alleviate some of that anxiety and that helps to prepare mentally folks for what could be happening. Then the fact that you mentioned that, yeah, this happens, but you know what? You can see it. So it's just like that wonderful colonoscopy that that we got to get. And the doc says, if you want to watch it, you can watch it. I don't want to watch it, doc, but thanks for the camera. But you have that option. And then the fact that, again, for the most part, right, you're in and out with procedure, probably, but I'll round up 2 hours, right? And you can go out and do whatever it is that you're accustomed to doing that same day. That's critical for folks to, again, know and not assume, because they would think that I'm going in for a p.a.d. procedure and I'm gonna be laid up in the couch for a week. No, you're not.
No, you're not.
Yeah. Let me ask you about this, and I don't know if you can answer it or if maybe the doctor can or something else. But let's talk about payment, right? Does insurance cover any of these procedures? How does that work, or is it out of pocket? Again, I don't want to assume. I'd rather ask the question direct.
So actually, there's both. So we take an array of insurances. We have Medicare, we have United Healthcare, Blue Cross, Blue Shield, Aetna, Novano, Imperial. There's just a slew of them. Hill Physicians, and if a patient, so let me give you a quick review. Sometimes folks want to pay out of pocket because they're like may have the plan where they can afford to pay up front. So we have where you can pay out of pocket. Some folks they don't have the insurances if they're self-employed, and their plans are skyrocketing, and they're having a lot of cost for having to pay in network as opposed to out in network, and it's sometimes it's all convoluted, right? So they're like, you know what, if I can pay out of pocket, I'll do that, and we have that option as well. However, primarily we go through the insurance because p.a.d. is medically necessary to get treated. So yes, both, and why I'm so excited about our event that we'll chat about later is because the initial ankle brachial index is provided complimentary. And with that said, to be able to have that as complimentary
Yeah.
You can go in, come out, and be ruled out right away and just say, oh my gosh, I'm glad I did that. And it was just by taking your shoes and socks off. See?
Well, you touched on it. We might as well go into it. I've got the screen up right. Perfect segue. Perfect segue. But folks, still continue to feel free to ask a question should
Ask
you have
questions.
one. But this is an event I believe that you've got coming up. Yeah, March 3rd here in Carmichael. So
Correct.
in the Sacramento area. 9:30 to 2:30. Where's it at again? It's literally at your office. Okay.
Yeah, 6450 Coyle Avenue. So we're directly across the street from Mercy on Coyle Avenue in Carmichael. And what's great about it is, like I said, it's a complimentary screening. And if you want to come in, there's a number there. It's a 916-965-5050. Call them up and schedule your appointment. And the reason being is because of COVID, we're trying to keep a, beautiful social distance. And we will schedule appropriately. So we typically can schedule every 15 minutes. That way we can do a minor assessment, and then you get your screening. And then the doctor will, talk to you for a minute or two just to kind of go over the things that they found. If they didn't find anything, it's great. You have, some dessert and coffee and hang out with us and maybe even tour the office. If we have something that we think that would be better looked at by an imaging or a Doppler, then we will ask you if we want to go ahead and move forward on that.
Okay.
But the great thing is that it is complimentary, and by calling in and scheduling your appointment, then what we do is we have different rooms. So we'll assess you. You'll go into a room and say there's a patient right behind you. We assess them and they go into the next room. So you're still socially distanced. We have sanitizers and masks. We're all sanitized in the office. You don't have to worry. And we will have chairs inside and outside to keep everyone socially apart. But we want you to be social. On top of that, we still want you to be social because we want to get to know you, and we want to get to know, what you're feeling about it. Like James, you talked about anxiety and stress. Anything is stressful when you don't know.
Yes.
But
That's true.
if we can give you all the tools and all the info and everything you absolutely need to know before, during, and after, you are empowered as a patient. And a lot of times the doctors, they don't say anything because they are inundated, and they don't mean to be like that. There's some great doctors out there, but if they're having a bad day because they have maybe what's called like a quota, they have to have so many patients in that day. It's stressful for them, and they by no means mean to not be empathetic or not care. Sometimes it's just they're so busy.
Yeah.
But what we've learned at Vascular Institute is we take it a step up. We take it an extra step to say, how are you feeling today and what can we do for you? And if you want to talk about it, that's great, because that's telling us that you're willing to make the change to find out about p.a.d. So I congratulate you when you do that.
While you were talking, I realized that link was just brutal. So I created a tiny URL for folks that actually links back to that. So links.james6.org/vascular will actually take you to that site as well. And I will make sure that's in the show notes for folks. We do
love
have
it.
another question here, and asking about TRICARE, right? So for military veterans, military active duty, and things of that nature, do you take that?
Yes, we do. We take TRICARE.
Okay.
Absolutely. Yep. And you know what I'll do, James, is I can send you a list of the insurances. I don't know if there's something you can kind of pop up and display. Is there a way to do that?
You can. Actually, you have the capability as well. You can share a screen, but I tell you, send it to me in an email message, and again, I'll consolidate everything and I'll put it in the show notes for on Facebook, on YouTube, and on my
Okay.
site, so folks can easily grab that, because I think that's critical as well. So
Yeah, and also what I can do also is on the Eventbrite, I can also add a document, and I could probably do that as well. So
okay.
thank you for asking that question about TRICARE.
Awesome. I'm trying to see here if we had any more questions. I think we've touched on. I was getting a handful of messages as well on my phone. So folks are watching, and they're saying, "Fantastic show, fantastic guests, great information." So it's resonating, right?
Thank you.
And I think, again, well, I know that everything that you have been talking about is going in, and it's staying. It's just not just falling out. So and especially the part about what the actual screening looks like and what the procedure is, right? I almost can feel the virtual sighs of relief, right? Of folks saying, "Oh, I think I do have something that may be similar to this, or to some of the symptoms that you were talking about, but I don't want to go in." But oh, you know what? Jennifer just said that it's not that bad to
It's
go
not.
in, get it done, and if it is the situation, to actually get it addressed. So again, I'm gonna say I virtually feel those sighs of relief. So
So let me kind of talk a little bit more. You mentioned earlier about if it was more prominent in other nationalities than the
mhm,
other, and I will say that it is a higher rise in Afro-American individuals.
mm,
Reason being is because there is a series of diabetes, uh, cardiovascular disease, and high cholesterol and high blood pressure. Now, that could be a result of generations, like we talked about before, generations of, different habits of eating. Like folks in Louisiana or folks from, the South, Alabama, Georgia, they're used to that. I mean, my mom is from the South, and we have fried corn, fried
love it.
orca,
Yep,
black-eyed peas,
gotta
but
have it.
everything's breaded, cornbread, and the desserts on top of the desserts on top of the desserts, right?
Yeah.
So we love that stuff, fried pork chop, and fried chicken. It's so yummy, totally, but in moderation.
Yeah.
So, back in the day, if you look back, a lot of our ancestors passed early because of conditions
Yes.
that there weren't doctors there to
Yeah.
relieve it or to fix it. So we're living a lot longer now. I mean, a lot longer. And
Hmm.
that's good, because that is telling our society that you are taking care of your heart and your soul and your mind. And we bring good peace with Vascular Institute, because when you have all that inclusive, and then you're able to come to us and say, we're willing to give it a shot. Hey, that just makes it even more powerful. I swear, I can't elaborate,
Yeah.
James. I can't elaborate how simple it is, and the impressions that the folks feel when they leave, because
Mhm.
they are so happy, and they're elated that they wish they would have done it sooner. They said, "Gosh, how come we didn't do this sooner?"
Yeah.
But no, that doesn't matter now. It's that you did it now. You know.
That's a good point.
Yep.
That's a good point. This has been awesome, right? Again, a goal and a focus of mine has been, well, especially for 2021, right? Is one is mental health, and especially mental health for men, because I'm going slightly on a tangent, but it's because
Okay.
men don't typically talk about those types of things, or take care of themselves as much. So mental health is one, but it always have been a focus around taking care of one's body as well. So
Yes.
I kind of hinted about physical, the mental, and the spiritual, and those types of things, and really assuring that we take care of that on a day-to-day basis, and take care of each other. Focus on community. Um,
Yes.
This message is resonating with folks. Again, I think every single question that I may have had and folks that I reached out to asking for questions ahead of time has been addressed. And I know a number of folks are on the session right now, hearing you talk and again, hearing, I'm gonna say the truth in your words and the way that you presented yourself and presented the story, because again, it resonates with you and you have a personal connection to the healing piece.
Yeah.
So again, I think that has definitely helped with the message. I'm keeping this link on screen right now so folks can go to that and hopefully register and get those consultations. Go in between 9:30 and 2:30 on the 3rd. Go talk to Jennifer. Go have some cookies and cake and some don't. I may come in just for the food. Well, I'll come in and get a screen too. But
Yeah, come
but
in.
again, yeah, that's good stuff. Outside of that actual event, because and I'm kind of putting you on the spot here because this is only in Carmichael. Do you have a list of maybe resources that folks not in the Northern California region could possibly go to for just p.a.d. information, right?
Yes.
And if you don't have them with you right now, again, we can put those into a list of the documents that I'm gonna put together for this session.
So actually, very simply, you could go to our website. Very simple. It's myvascular.com, www.myvascular.com. And we have locations in Texas and we have locations in Arizona right now, but we will be expanding. We will be expanding. We love what we do. And we know that it's p.a.d. is definitely something that a lot of folks don't realize is very, very crucial to know about.
Mm-hmm.
Reason being is we talk about, all the other things. We talk about diabetes and cholesterol and heart disease and things like that. But a lot of doctors do not talk about the lower extremities. And what happens is we want to prevent amputation. That is our number one goal, is to reduce amputations. Because let me be very honest, what happens is when these diseases get critical and you go to the doctors, a lot of times because it's old school, all they know is surgeons, and they'll send you to the hospital and say, well, you have to get the amputation. Well, you need to call Vascular Institute first. Now, I'm going to tell you a very quick story. 2 weeks ago, there was a lady and a gentleman, they're a married couple, had gone into a vascular surgeon's office, okay? And they were given the results of their findings. And the lady was absolutely just couldn't believe that she may have to get an amputation. So she couldn't even talk to the doctor any longer. She says, I just have to leave. So her and her husband left, and she was crying, and she went out to the car. And the husband was kind of behind her. And in the lobby was my brochure for Vascular Institute. So the husband grabbed a copy of it, because down the front, and I'll show you right now, this is what it says. You can see it. It says, do you have leg pain, leg sores, tingly, heavy, or cold legs and feet? It could be p.a.d. So he took it, and they went into the car and they read it. And the wife says, let's go in there. Let's chat with them. So they came into our clinic. We scheduled them an appointment. They got a procedure done, and she was absolutely fine. Didn't need an amputation.
Wow.
So that's what's magnificent about what we do. And if I could spread that word all over the universe, that's what I will do, because it like I said, it's so easy.
I love it. So that's the story that I want. I can't top that, right? Just that whole aspect. Folks, this is perspectives and focus. Jennifer, thank you very much for taking the time to come and talk to us. We will do this again in a couple of weeks when we have the doctor come on and get a little bit more granular in terms of questions that folks may have. But folks, again, take this information to heart. Take a look at the links that we've sent. Jennifer will always be available because you have her phone number on that brochure that I posted. And if you have questions about the procedure, you should be less hesitant now. Let's say that, less hesitant of going in and taking care of yourself. That being said, Jennifer, thank you again for your time, and we
Thank
will
you very
definitely
much.
talk soon. Appreciate you.
Thank you, everybody.